Ladies and gentlemen, Assalamualaikum and hello, my name is Rosalina. Do you know that children with autism spectrum disorder need constant oral health care from their caregivers? Therefore, in this presentation, I'm going to share with you the findings of the caregivers' knowledge, attitude and practice in their children's oral health care. Autism spectrum disorder, or acronym known as ASD, is a behavioral syndrome affecting the social communication, showing repetitive behaviors and restricted interests. It can be detected as early as 3 years old and affecting more males than females. The characteristics of ASD can affect their oral health status. To the best of our knowledge, there is insufficient local study on the assessment of the caregiver's oral health KAP. Adequate oral health KAP is crucial, and the findings from this study would be a basis to plan a more comprehensive education program for the children. Generally, we would like to assess the oral health KAP of caregivers of children with ASD, and specifically, we would like to determine the knowledge, attitude, and practice. This is the research question and research hypothesis. Our study is a cross-sectional study and was conducted at the Oral Health Specialist Clinic Hospital USM. Our source population included all caregivers of children with ASD aged 7 to 12 years who registered at the Psychiatry Clinic Hospital USM. We included caregivers aged 18 years and above and excluded those with mental disability and hearing impairment. For the sample size calculation for objective 1, 2, and 3, we used the single proportion formula. This is our sample size calculation. In summary, the highest sample size was 72 subjects. However, there was a total of 68 ASD patients in the Psychiatry Clinic Hospital USM. Therefore, all 68 caregivers were included in our study. We included the proforma, which consists of the caregivers' profiles and questionnaire regarding oral health knowledge, attitude, and practice, adapted from Ngah et al. The questionnaire has 3 domains and 22 items. These are the items for the knowledge, attitude, and practice. This is the data collection procedure. Data entry and analysis was done using the SPSS IBM version 26.0 and descriptive analysis was done. This is the ethical approval. Most of the respondents were mothers. Mean age of all respondents was 39 years old and all were Malays. 34.4% of the caregivers received STPM education level. 37.5% work in the government sector, 46.9% were categorized as low income. 59.4% of the caregivers came from Kota Baru. 65.6% answered that sugary foods or drinks are best limited to meal times, and 84.4% answered that it is preferably for a child to eat a bag of sweets gradually consistently. 75% answered fruit-flavored drinks are safe for children's teeth, and 59.4% answered most syrup medicines contain sugar. 53.1% thought that the child needs to start oral hygiene care when first tooth come through. 93.8% knew that brushing teeth or gargle after meals can prevent caries. 59.4% knew that children need to brush twice daily, and 68.8% knew about pea-sized toothpaste for children. 87.5% knew that fluoride strengthens enamel. 34.4% thought that the child's age to start visit dentist is 13 to 24 months. And 87.5% knew that dental visit is for checkup. For oral health attitude, 43.8% strongly agreed that there is a need to concern about baby teeth, and only 18.8% who strongly agreed that it is worthwhile to fill a cavitated baby tooth, although it will be replaced by a permanent tooth. 75% strongly agreed that regular dental visits are very important. 71.9% felt that dental filling is required if a child has a cavity in a permanent back tooth. 62.5% felt that dental filling is required for a cavitated permanent front tooth. 68.8% strongly agreed that brushing twice daily for 2 to 3 minutes maintains a good oral health. 65.6% of the caregivers felt that the child needs to be assisted by an adult when brushing. For oral health practice, 37.5% claimed that the child brushed twice daily. 87.5% used toothpaste when brushing. 62.5% used toothpaste with fluoride. And 46.9% used pea-sized amount of toothpaste. Most of the caregivers were mothers and all respondents aged between 31 to 47 years. These caregivers' children aged 7 to 12 years mostly attended government primary schools, received dental treatment from the Ministry of Health or other resources, and attended the occupational therapy in the hospital USM. The majority of caregivers had secondary education and were employed. Consistent with the survey by the Department of Statistics Malaysia, the caregivers had low income and earned below 4,000 ringgit Malaysia. We managed to obtain 100% response rate from the 32 respondents. 65.6% answered sugary foods or drinks are best limited to meal times. Children with ASD prefer snacking between meals. Their frequent sugar exposures can lead to dental caries. 53.1% answered child's age to start oral hygiene care when first tooth come through, which was incorrect. The correct answer is at birth. It was found that 5% children had delayed eruption or missing teeth. Therefore, dental checkup is recommended for infants and young children. 43.8% were strongly agreed that there is a need to concern about baby teeth. According to Al-Humaid et al., caregivers performed oral health care for their children only when oral health problems occur. 65.6% answered that their children were assisted by an adult if they insist on brushing on their own at a very young age. Children who are brushed by the caregivers have a better dental health and lower caries prevalence. 62.5% used fluoridated toothpaste for child. Some caregivers refused fluoride, and these are the caregivers who refused vaccination as well. 46.9% used pea-sized amount of toothpaste, which provide protection against dental caries. It was reported that most of caregivers dispensed oversized toothpaste for their children. Limited sample size obtained due to less children with ASD aged 7 to 12 years available in psychiatric clinic and declination of invitation by the caregivers. Data collection took longer time than expected because appointments were mostly on the caregivers' availability as they need to manage their children at home, and many requested to be on the same day as the occupational therapy in USM hospital. We recommended that awareness programs should be developed for caregivers to encourage them to seek preventive oral health care. Caregivers should be encouraged to seek professional oral health counseling as soon as possible. Future studies need to be conducted with bigger sample size and include severity of ASD and difficulties faced by the caregivers during their children's toothbrushing routine. To conclude, caregivers of children with ASD displayed a basic understanding and attitude on oral health. However, their practice towards oral health care was unsatisfactory. Oral health intervention for caregivers is crucial as they play a major role in caring their children. I would like to thank Prof. Dr. Nomastura, Dr. Munira, and Dr. Nozila for their guidance and advice, as well as the participants in the research, my husband, family, and friends. These are the references. Thank you.